Tell me about yourself. My name is Caitlin McTish, and I'm the Manager of Healthcare Provider Engagement for the National MS Society. I currently live in Los Angeles and oversee territories in Southern California, Hawaii, and Nevada. All of the healthcare relationships in those areas are mine to cultivate and bring change to, positive change, of course. When I started, about 10 to 12% of these relationships were failing. I have since turned them around to make them positive and more engaged in society, helping those living with MS. A few of the top initiatives that I do lead as Manager of Healthcare Provider Engagement are our local council, which is a group of 10 to 12 high-level MS specialists in the area. We implement monthly projects and we meet to figure out the gaps in the local community. Second, I organize and implement an MS Summit. This is an accredited healthcare event where we invite all disciplines to learn more about MS and treating MS. And third, I attend local conferences to learn a little bit more about MS myself and engage with the providers that may be attending. Previous to the National MS Society, I worked for Village Care of New York. I was in managed care, overseeing all home care agency cases. I was then promoted to the skilled nursing facility. The skilled nursing facility is a subacute center with 105 beds where I oversaw all managed care issues, which would be insurance issues, appeals, denials, and made sure that the patient was safe to discharge. I am currently enrolled in the MBA program for healthcare management at the University of Delaware. In addition to that, I am always making sure to professionally develop myself. This entails taking Lean Six Sigma trainings. I'm currently on my white belt, but plan to achieve the yellow and the green in the coming months. Aside from that, I'm a member of the American College of Healthcare Executives, where I'm able to find mentors, network with other healthcare executives, and stay current on healthcare movement and change. Tell me about a conflict or a challenge that you faced at work and how you dealt with it. The most current conflict I've had at work was with our programs department. Our programs department oversees programs that are implemented for those living with MS. There's a fine line between what I do and what the programs department does, because they assist people living with MS and I assist the providers for those of people living with MS. Most recently, we are invited to an event at the local VA to serve as a support group leader. I have no involvement in that in my daily role. However, none of the program staff was able to attend. This created conflict because it made it a challenge for our organization to show representation. So instead, I decided that I had time in my schedule to attend this event. Future conflict may not be as easy to navigate. The programs department understands that I'm not able to step up for all of the concerns and issues that they may not be able to cover, but I am also still open and willing to help if I have the capacity. Tell me about a time that you contributed to success at work. Provide details. I often make sure I'm contributing to the success of the Healthcare Access Department. A few ways I do that. I reach out to our VP to submit goals, feedback, and how I feel about achieving those goals. I also make sure to attend our monthly discussion calls where we're able to bring up problems or solutions to those problems as a team. And third, I'm a part of the pediatric work group and the targeted population work group. My most recent success was in the targeted population work group. We're currently trying to establish an implementation guide for other healthcare access managers to follow and engage those at the VA. This could include their healthcare providers, veterans, and their caregivers. We tried to make sure to cover all bases. In the beginning of developing our implementation guide, we realized that it may be difficult to include strategies about healthcare providers if we didn't actually engage them first on their feedback for this guide. It was my idea to invite a few healthcare providers from my local community to come and speak to our work group, to give us feedback on the questions that we were going to assess within our guide, and then to include them in a way that made most sense.